If you've been feeling tired or overly fatigued and rest is not helping you, you might not be alone. The CDC now saying that chronic fatigue syndrome is not rare. 5 News reporter Jose Carranza spoke to a local medical provider about this syndrome. He shows us how it's growing.
An icebreaker for my patients.
At Northwest Health Medical Plaza, National Park posters fill patient rooms and the desk of Thompson Davis.
So we're able to kind of dive into a visit with a patient on something that's not medical. It is a great stress reliever to go to a national park.
But for some patients, a hike in the woods could be not as simple.
Chronic fatigue syndrome is exhaustion or fatigue experienced for greater than 6 months. And it's not relieved by rest.
About 3.3 million American adults could be experiencing chronic fatigue syndrome. These numbers a new high, according to the CDC.
They're just forever fatigued. Whatever they do during the day, they never feel rested, or any physical exertion or mental thing that they try causes them to be fatigued, where they feel like they can't get up and do anything else.
He says these new cases could be attributed to a more recent phenomenon, long-haul COVID.
The symptoms are similar, and I think it's easier as a provider if someone has had COVID-19 to try to lump those symptoms of chronic fatigue on maybe that was from this viral infection.
While he says there is no official medication for the syndrome, Thompson Davis explains there are ways to help.
Those patients that fatigue is an underlier, but they'll have extra things on top of those that we can provide treatment for. But it may not specifically get away from their chronic fatigue. So we also have to encourage those patients to try to actually know their limitations, but also to kind of push themselves so that they're not, just stuck at home not doing, anything because they feel that they're unable to.
In Bentonville, covering news where you live, Jose Carranza, 5 News.
The Northwest Health provider says anyone experiencing those symptoms should just visit their doctor.